So, menstrual pain, which we commonly call as the period cramps, which clinician in fancy terms called as dysmenorrhea. It is a cramping pain in our lower abdomen, that is below our belly button, in during periods in a ovulatory cycle. So, what is an ovulatory cycle? A cycle in which our ovary releases the egg, and this pain is not same as the PMS, that is the premenstrual syndrome. So why does it occur? It occurs due to a sudden drop of the female hormone progesterone, which constricts the blood vessels of the uterus, causing release of a chemical known as prostaglandin F2 alpha. So what does this molecule do? This molecule repeatedly constricts and relaxes the muscles of the uterus, causing spasm and pain. So the two types of dysmenorrhea are the primary and secondary dysmenorrhea. Primary dysmenorrhea is usually self-limiting and does not need a treatment, and secondary dysmenorrhea is something which definitely asks for a medical treatment. So how to know what kind of period pain you have? So primary dysmenorrhea, aka the spasmodic dysmenorrhea, is very common in young adolescent since 1 to 2 years after menarche. That is, the initial 1 to 2 years after the onset of menstruation are painless, and suddenly the girl child complains of painful periods, and it also occurs in females with heavy flow. So the characteristic feature of this one is that it starts with menstruation or 1 to 2 days before menstruation and subside with the onset of menses, or may persist longer but not more than 48 to 72 hours. So it is cramping in nature. The intensity varies from mild to severe. It is not continuous, that it does not occur all the time, and it is centralized to a lower abdomen. And the very good part is it is not associated with any infection or disease in the uterus or any of the reproductive organs residing in our pelvis, which we call as pelvis pathology. So the secondary dysmenorrhea, aka the congestive or progressive dysmenorrhea, is always associated with some kind of infection or disease in our pelvis, that is the hip part where the female reproductive organ lies. Therefore, it warrants medical attention. It is more common in females of reproductive age group, that is more than 30 years of age, and the patient presents with history of painful menses since few months. And the characteristic feature is that it starts 3 to 5 days or much before the menses and does not subside even after the start of menses. And the pain keeps on increasing, hence the name progressive dysmenorrhea. And it is usually associated with dyspareunia, that is pain during the intercourse, and dyschezia, that is pain during defecation, that is pain during passing of the stool. So now we come to the treatment part. So primary dysmenorrhea gradually decreases on its own with increasing age or after childbirth or with regular physical activity. If it does not decrease by that, then the conservative methods can be having heating pads over your lower abdomen, doing regular exercises, and avoiding stimulants like coffee, alcohol, and smoking during these days. If above does not work, then you can see a gynecologist, and there the first thing that is prescribed is known as NSAID, that is non-steroidal anti-inflammatory drugs like aspirin. So what it does, it reduces the production of prostaglandin F2 alpha. So if even that doesn't help the patient, then the other treatment modalities are OCPs, that is the oral contraceptive pills. Then we have the vaginal rings, and IUD, that is intrauterine device Mirena, which secrete hormones in a body that makes the menstrual cycle and ovulatory, hence alleviating the pain. Now we come to secondary dysmenorrhea. Since secondary dysmenorrhea is based or due to a pelvic pathology, treating this pelvic pathology will resolve the pain on its own, and therefore you need to see a doctor for secondary dysmenorrhea. So I hope this video helps you understand the basics of menstrual pain, that is dysmenorrhea, which we women go through every other month, and also to know when to seek medical help so that you can get yourself treated on time. And thank you, and take care, and bye-bye.